days on the set is when he had gone to Dr. Klein's office, which is about 3 times a week. And when he came back, he was basically wasted and required at least 24 hours for recovery. Why would he have shared with me the fact that he was seeing a dermatologist or another doctor for any kind of treatment that he did not share?
Is Dr. Conrad Murray throwing Michael Jackson's friend, the dermatologist Dr. Arnie Klein, under the bus? Once again, Dr. Klein's name comes up during testimony at the Michael Jackson death trial today. And Dr. Murray could be heard telling cops that Michael would go on secret visits to Dr. Klein's office and come back slurring. Allegedly, according to Dr. Murray. Tonight, in an Issues exclusive, I am joined by the attorney for Michael Jackson's dermatologist, Dr. Arnie Klein. Garo Garzarion, thank you for being here. Mr. Garzarion, once again, your client is being thrown under the bus by Dr. Conrad Murray, the defendant in the Michael Jackson homicide case. Your reaction, sir?
Well, first of all, they need to go through me to throw him under the bus or anything else, and that's not going to happen as long as I'm on it, because nobody was doing any secret meetings. And when the medical records come out, you know, I've been hearing enough about daily visits, 3 times a week visits. You all will see that in the month of June, 3 weeks before Michael Jackson's unfortunate death, he had seen my client 3 times. 3 times in 3 weeks. That's what you will see.
Okay. Now, let me ask you this question. When he visited Dr. Klein, did he get Demerol? And if so, for what?
Well, here's what I'm going to say about that. I'm not going to get into medical procedures. The medical record speaks for themselves. I have consulted medical experts, and I believe the record will show that he did receive this substance known as Demerol, but I also believe that it will show to be not in qualities or quantities that are exceeding the use and the purpose for it. The experts that I've consulted, who are very renowned, who are chief of anesthesiologists, a very renowned hospital, will tell you and will tell all those other experts and the pundits that have been talking for the last several weeks that they're wrong. They're wrong. Dr. Klein has done nothing wrong. If he had, he would be the one that would be charged, which is, of course, you know, takes me back to my initial saying, Saudi, some other dude did it. Well, Dr. Klein did not do it.
Yes, and there are analysts who say that when somebody, even before they're charged, starts pointing the finger at somebody else, that's a sign of a consciousness of guilt, because they're proactively pointing the finger at someone else. Now, Dr. Conrad Murray tells cops in this audio-taped interview that Michael, as you just heard, one side, here's his claim, that Michael would see Dr. Klein 3 times a week. We're going to analyze it a little bit more. Listen to this.
I was not aware of any other medications that he was taking, but I heard that he was seeing a Dr. Klein 3 times a week in Beverly Hills. And he never disclosed that.
Now, he says he was not aware of any other medications that Michael might have been taking. But we know that there were medicine bottles all over Michael Jackson's room, and one of them was prescribed by Dr. Arnie Klein. So how could Dr. Conrad Murray say he was not aware that Michael was getting any other medications?
Well, all I can say is this. If I went to the doctor's office and the doctor left the room, there would not be a host of medications there for me to have with and do with as I see fit. Let alone in my home, if I had a physician, to leave medication all over the place and disappear. I'm not going to prosecute this man, but I want to say something here on your show, Jane, for the first time. There will come a time that I will produce conclusive evidence that Michael Jackson walked in and walked out of his own free will and of his own ability without the need of any assistance, not staggering, not delirious, and not stuttering, and not drugged up as Conrad Murray's lawyers have suggested. All
right. Well, let me ask you one other question. I think it goes to the heart of the matter. You say that Michael Jackson visited Dr. Klein 4 days prior to his death. You also said Demerol only lasts a day or 2 in your system. Now, is it possible, given that he hadn't had Demerol in 4 days, that he was suffering from Demerol withdrawal that created the insomnia? Briefly.
Well, I don't think so, because the Demerol, first of all, in order to be addicted to Demerol, one has to take Demerol on a regular basis, and the medical records that I've reviewed on behalf of my client do not support such an addiction. Did he have a dependency? He may have had a dependency, but the records do not support an addiction or a dependency, in my opinion.
Well, that's why we have you here. We want to be fair. We want to get all sides of the story, and thank you so much for your defense of your client. More in a second.
He had said to me that the doctors allowed him to infuse it himself. I love to push it. It makes me feel medicine is great. He complained that he couldn't perform.
He entered into rehearsal full of energy, full of desire to work.
You've administered it more than 10 times?
Yes.
More than 20 times?
30 days a month, roughly, every day. He loves that drug.
The levels of propofol found in Mr. Jackson's body were at levels similar to general anesthesia.
I took all the precautions.
Did you observe any medical equipment?
No, sir.
So I started immediately to perform CPR and mouth-to-mouth resuscitation. I swiftly went a single man resuscitation. I saw his chest rise.
I did not personally ever feel the pulse.
I couldn't ask him at that time to call 911 because he would want to know what it was about. And I have a patient that needs help.
It was, call me right away, thank you.
The evidence so overwhelming it sent one fan running from the courtroom. Hello, everyone. Jane Velez-Mitchell back with you live in Los Angeles. The Michael Jackson death trial had its most heated day, yet emotions running wild. The most devastating image released was the King of Pop's own autopsy photo, which showed his gaunt, cold, naked body laid out like, like an autopsy photo. I'm going to show you just part of it. And for a very, very short period of time, this is evidence in court, put up in open court. So we're going to show it to you for only a couple of seconds. Again, a warning. This is Michael Jackson's arm with tiles beside his body reading August 25th, 2009. Now, the doctor who was doing the autopsy claims the date, well, it certainly was wrong. Michael Jackson died June 25th, 2009, not August. That's kind of a disturbing sign of sloppy work, if you ask me. Not only that, we also heard the raw, pained reactions from Michael Jackson's own children who were there as they learned their father died. Listen to this police interview of the defendant, Dr. Conrad Murray, telling cops about it.
They cried and cried and cried. Then his daughter uttered a lot of words of happiness, and she would live alone without her dad, and she didn't want to be an orphan. And real sad, real sad. She's like my daughter. And I told her, we will take care of her. Frank Durand said that he would take care of her also.
All right, well, guess what? Now we're hearing that the 8 was really a 6. So apparently they didn't get it wrong. It just looked wrong because it looks like an 8. There you go, just one of the many confusions of this trial. Were you disturbed by today's testimony? Give me a call, 1-877-JVM says. Straight out to Rabbi Schumley Boteach, author of 10 Conversations You Need to Have with Yourself. Rabbi, what an emotional day as these autopsy photos were revealed. Your reaction as someone who knew Michael Jackson well.
Well, you know, Jane, when I was close to Michael, I was consciously aware of the fact that a somewhat naive superstar had placed his life in my care, and I had to bend over backward to do the right thing by him, restore his credibility, make sure he wasn't around children so there can't be any wrong allegations, get the media to understand him better, get him to lead a healthier life. What I don't understand in the last conversation, incredible conversation you had with Dr. Klein's attorney and hearing Conrad Murray's testimony is, Michael put his life in their hands. I mean, why was he getting any more plastic surgery? We all know he had too much. Why was he being put to sleep with hospital-grade anesthetics? You know, so many of these doctors have to explain things to us. My reaction is that there's protests all over the country now against greedy bankers. The doctors are now on trial. We're seeing more and more doctors who are creating a pill-popping society where every time your kid is a little bit hyperactive, you shove them on on Ritalin. And if you're a little bit depressed, they shove you on an antidepressant. And if you're a superstar with a lot of money and you can't sleep, instead of telling you, the superstar, you need psychological evaluation. It's not normal to never sleep. It's not normal to be this down, this depressed, to be addicted to sedatives and to painkillers. You need psychiatric evaluation. Instead, they fed him this poison that killed him. And it's like what I said the entire time.
And I agree with you, Rabbi.
Only one person's on trial.
Rabbi, I actually wrote about this in my book, Addict Nation, an Intervention for America, where I describe America as an addictogenic culture where we encourage self-medication. Now, check this out. It's just a snippet from a fascinating documentary called Gone Too Soon.
Everyone has a piece of the puzzle.
Conrad Robert Murray.
People, have you heard of this thing that takes you to the valley of death and then brings you back?
If we finally put them all together.
Were you ever accused of having sexually molested Brett Barnes?
Won't answer that.
What would we see in the big picture?
And with me tonight, filmmaker behind this remarkable project, Ian Helprin. Ian, you've been hearing the testimony. We heard Dr. Conrad Murray talk to cops on audio tape, rationalizing and justifying his behavior. What say you?
Well, a lot of bombshells, Jane, were dropped in the courtroom today. But again, we got to go on the scientific evidence. And the defense is really going to get into the medical examiner. And have already debunked a bit of the theory as far as the type of medication and the amount of medications that were put into Michael Jackson's body. But I got to ask the Rabbi Schumley one question. When he talks about them, who are they? Rabbi Schumley knew MJ better than just about anyone, and why are they scapegoating Murray? Why aren't more doctors charged? I know for a fact at least 20 doctors enabled Michael Jackson with drugs. Why aren't they standing trial too?
All right, quick answer, Rabbi. We've got a doctor on call here, so quick answer.
Well, it's not only the doctors, and he's absolutely right, but it's also AEG. I mean, here you have a company that was putting on 50 concerts. Was Michael ready for it? You have the director of the concerts writing to the chairman of the company, Michael's not ready for this. I'm massaging his feet. He's freezing cold. He needs psychiatric evaluation. Everyone is sounding these alarms, but profit, money, and it's astonishing to me that only one person is being charged. That doesn't mean that he's being scapegoated. Conrad Murray ultimately gave him this propofol under settings that should never have been allowed, and he seems kind of guilty. I don't want to make that conclusion because, of course, he has the presumption of innocence.
Can I say one thing in defense of AEG? I'd like to say something in defense of AEG. First of all, that meeting was just a couple of days before Michael Jackson died. We're going to talk about it in a second. But also, Dr. Conrad Murray never revealed to AEG that he was giving him propofol. Of course he didn't, because they would have been horrified and they would have backed off. Nobody was going to underwrite something like that. So
Jane,
AEG did not know.
Anyone who was in Michael's vicinity for years knew that his life was in steep decline. This is a fallacy that people did not know how poorly his life was being conducted.
But
Michael
Rabbi, you were good friends with him. If you could relive it, you tried to get him off the drugs. You and Elizabeth Taylor were the only two people. In hindsight, if you could have done things differently, what would you have done differently to save his life?
Look, shoulda, coulda, woulda, everybody would like to say that they could have done something. I don't know that you can force another adult to live a life that you want them to live unless they want to change. I want to bring in Dr. Natalie Strand, who's an anesthesiologist, and we have some equipment here, and we want to just show you what we've got so that we can try to understand this case. Can you hold this up?
Sure.
Okay, this is a saline bag, okay? Now, this is what I don't understand. This is the propofol. According to the prosecution, which, of course, they forgot to take a picture of, the coroner.
Would have been helpful.
This was sliced open, and this propofol was inside here as a makeshift drip, okay? And the question is, did Dr. Conrad Murray give him the propofol that killed him, or did he somehow, with one of these ports that was connected to his leg, or perhaps drinking it, or in some way give himself the fatal dose. So you were telling me this is not ever supposed to be in a saline bag.
Absolutely not. I mean, when most people run a propofol infusion in a hospital setting, they'll connect an attachment that runs through one of these side ports. So it'll be a separate access port that runs it. If you cut open the bag and put the bottle inside, you're sacrificing sterility. The outside of the bottle is not sterile. So then you're giving an intravenous substance that isn't sterile. In addition, I don't know, I mean, if that's really what he was doing, that just kind of illustrates his extreme lack of knowledge in this area. I've never seen anybody do it that way. I don't know how he would have jerry-rigged a system to even work like that. So, you know, the idea of cutting open the IV bag and having a bottle in there of propofol doesn't make any sense at all to me. I've never seen anybody do it that way.
So you're saying that would be almost like something you would do if you were on an episode of Survivor and you were camping, and this was something you were doing out in the wild to jerry-rig a system like this. But
it's a very creative solution.
Yeah, it's a very creative solution. And what does it tell you as a doctor?
It tells me what I already know, that his judgment is really poor, that he didn't know what he was doing, that he was practicing medicine in an area that he wasn't trained in, that he wasn't comfortable in, that he didn't have the appropriate skills to do. So it further just supports everything that we've already seen about Dr. Murray.
But I will say this, with so many different ports and possibilities, it's going to be hard for the jury to narrow it down to something that happened beyond a reasonable doubt. There is a lot of complexity here, and in complexity, there can be reasonable doubt. And that is, I think, what the prosecution has to worry about. This is complicated stuff, and they've got to boil it down to people terms. Up next, an Issues exclusive, a guy who was there hours before Michael died.